Okay, now I'm excited to welcome our sixth team, Ocular Technologies, a team disrupting the field of eye care. Presenting tonight is a student I know well, CEO Brett Sternfield, who's a 2020 MBA from MIT Sloan. Take it away, Ocular Technologies.
Vision empowers life, but 2 weeks ago, my dad and I were forced to make a choice: risk his vision or risk his life. He requires regular eye care to preserve his vision, but is homebound and severely immunocompromised. His doctor emphasized the importance of his appointment, and so we kept it. 1 week later, he was admitted to the hospital with COVID symptoms.
Most patients with eye disease are older, and they're at high risk of infection if they come into the hospital. Ideally, I'd be able to examine a patient and get all the information I need to manage them through a telephone or Zoom. Those tools do not exist today, and that limits how I can care for my patients remotely.
There are 100 million eye conditions in the US and only 19,000 ophthalmologists to address them. Month-long wait times are not uncommon, and if you have an urgent eye condition, you'll seek same-day relief at an emergency room or urgent care center instead of seeing an eye doctor. These locations lack the tools and the expertise to properly diagnose and treat eye conditions. At Ocular, we're expanding access to quality and timely eye care with new imaging technologies and telemedicine. Our solution consists of 3 components. First, our device called Ocular One is a low-cost solid-state system that replaces multiple pieces of ophthalmic equipment and enables an automated exam from across the room or across the world. It utilizes patented MIT Media Lab technology to capture diagnostic quality imagery of the eye. Second, our software combines advanced machine learning models and closed-loop control systems to emulate eye care expertise. It helps to record, filter, and transmit eye exams. In the near future, it will triage and even diagnose eye conditions. Finally, our partnered eye specialists will use our software to review exams remotely, make a diagnosis, and provide patients with a treatment plan. Our system will turn any care facility, even a patient's home, into an eye doctor's office, and will save ophthalmologists precious time caring for patients. We will collect revenue from device sales and software fees paid by the originating site, the place where the patient gets the exam. The device will enable additional billings and pay for itself within 3 months. We will also generate revenue through reimbursements from insurers for every remote consultation our eye specialists perform. Together, revenue will total $10,000 per year per device, using existing reimbursement codes covered by Medicare. In phase 1, we'll sell to emergency departments, urgent care centers, and optometry offices. Next, we'll expand to retail clinics, skilled nursing facilities, and in-home care. Together, phases 1 and 2 total over $1 billion addressable market opportunity every year. Throughout our scale-up, we will also collect the largest labeled pathologic anterior segment dataset, meaning we'll be at the forefront developing automated diagnostic tools for front-of-the-eye condition. That's 70% of eye conditions in the US. COVID has rocketed our company forward. First, it generated commercial demand for our research prototype, Ocular Alpha. Alpha bolts onto an existing device called a slit lamp to enable remote diagnostics, improving the efficiency and safety of eye care during and post-COVID. Today, it is in use at Mass Eye and Ear and Boston Laser. We have demoed Alpha to 7 additional eye care institutions, and all 7 are interested in paid pilots to start this summer. 4 academic groups are also submitting clinical study proposals using Alpha and will begin enrolling patients in June. Thanks to our partnership with New England College of Optometry, we built a national network of over 200 eye professionals who are onboarding to our remote consultation platform. And finally, we have engaged the FDA and are seeking emergency use authorization to market and sell Alpha this summer. Our team has close ties to the problem we're solving. I'm Brett Sternfield, and I study biomedical engineering and optics to help improve eye care for patients like my dad. My co-founder, Zona, struggled to see an eye doctor when she had an urgent eye condition. Her background in finance and operations helps Ocular ensure others don't suffer the same experience. Dr. Grayson Armstrong, Chief Resident in Ophthalmology at Mass Eye and Ear, first synthesized the idea for Ocular, inspired by the challenges he lives every day providing care to his patients. We're also supported by a beastly lineup of MIT engineers and operators. We're fortunate to work with thought leaders in ophthalmology, optical engineering, insurance, and medical device development, people who share our vision for the future of eye care. Judges, We are rapidly growing, and the first place prize would enable us to go to market and address an immediate need for telemedical eye care here in Boston and across the country. We have the product, the manufacturing partners, and the customers. Now we just need your help. On a positive note, my father was discharged after a 4-day hospitalization, testing negative for COVID. Ocular's goal for the summer is to prevent even one other family from having to choose between vision and life. Thank you.
Very good. Thank you. Thank you. And it looks like our Ocular Technology team is quarantining together. Hello, team there. And we're going to start off the questioning, if that's okay, with Ron Chaney.
Hi, that was a great pitch. Thank you. You talked about using examinations from the front of the eye as your first target application, in part because other companies specialize in back of the eye exams. To what extent would you consider partnering with those companies to provide more comprehensive capabilities sooner, as opposed to thinking of them as competitors and developing those additional capabilities in-house?
Thanks, Ron. I think that's definitely something that we are thinking about as we look forward at our product roadmap. As of today, there is no database that exists for front of the eye condition. So we're not even competing with those companies that are in the back of the eye space. But instead, we will be the first company that is going out there to collect those data and develop those models that will enable us to have the automated diagnostics. And I'll pass it over to Grayson, who's kind of in the trenches every day dealing with the patient and those conditions.
Yeah, I mean, there's a lot of companies that are doing back of the eye imaging. They are likely going to be early teammates of ours that we work with to try to get this to be a comprehensive exam earlier than later. So that's definitely in the plans early.
Great, great, great. On to Sarah Hodges.
Hi, congrats. That was a great pitch. I'm curious, what percentage of a typical eye exam can this automate?
So every single eye exam, 100% of eye exams use a slit lamp, which is the machine that we're automating. So we'll be involved in every single eye exam in the country at some point, as long as this takes off like we plan. You know, the back of the eye does have a lot of pathology, and our early device will not address the back of the eye solely. So, you know, we will be involved in 100% of them, but it addresses maybe 70%, like we talked about, of the eye conditions that can be diagnosed.
Great. Okay, on to Adam Falcon. Oh, you need to unmute.
Sorry. In your business plan, you talk quite a bit about telemedicine and the rising tides there. Do you ever envision an at-home solution where the device cost is actually low enough? And if not, how do you really think about taking advantage of telemedicine?
For sure. Go ready.
So when Grayson and I first met, we were focused on improving access to eye care for the developing world. And actually our first technical solution was something that leveraged low-cost mobile and virtual reality components. So really in the very beginning, when we were bright-eyed and bushy-tailed, we wanted to go after this super low-cost device. And absolutely, that's still on our roadmap. But what we realized is there was an incredibly high demand for actually providing more efficient telemedical care in traditional eye care facilities. So it's on our roadmap, but in the near term, we're going to be focusing on those first low-hanging fruit.
And part of the conversations that we've had with some of our early partners with the studies is that there's a lot of patients that have high utilization need. And so those patients might actually need this in their home early because they need frequent exams for blinding conditions.
Very, very good. On to Jason Troutner.
This is a great product. I have a question about your regulatory strategy. So when you're seeking your 510K clearance, can you talk about how adding the remote component to the traditional slit lamp affects your regulatory pathway and specifically your ability to use other non-remote devices as a predicate device?
Thanks, Jason. That's a great question. We just got off the phone with FDA yesterday, and was actually trying to figure out what the classification of these simple shields are that we're using to help protect doctors today. By the end of the call, we were with the head of digital health and ophthalmology, and I asked, what do you need right now? What is really the need that you see? Telemedicine was the resounding answer. And absolutely, while telemedicine and ophthalmology is woefully insufficient right now, everyone recognizes its immediate need, not just for COVID, but post-COVID and out long-standing to improve access to eye care. So without a predicate device for telemedical examinations, we're not worried about that. First, because it's going to be the diagnostician, the doctor in the beginning, who's making that decision. It's just the same as it is in radiology. Second, we're not worried about it because of the overwhelming market need. And we're working on building letters of support from chiefs of ophthalmology in every Boston eye hospital to go to the FDA and say, we need this now.
Yeah, so for us, I think it's definitely not Ocular versus FDA, but we're working with the regulator to bring something to market that will benefit everyone.
Great. On to Leandro.
Hey guys, I'm going to actually move away a little bit from telemedicine for a little bit. In your business plan, you're talking about the delay of getting appointments, and you talk about decoupling the process between the exam and the diagnosis, which I think is very interesting. If I understood this correctly, the throughput of this will increase when you get the automated triage and diagnosis. So can you explain us how far are you from that? Where are you going to get the data to train your algorithms? And how far are you from that? I'm very curious.
Yeah, so it's a really complicated question. And a lot of the AI that's going on in back of the eye, it's a very singular disease they're focusing on. Front of the eye conditions can range from everything from a light pink eye to what Grayson deals with every day, ruptured eyeballs. And so what we're going to be doing is tackling the lowest hanging fruit, the things that have the highest value to the system, but the lowest complications if they were to be misdiagnosed. And actually, pink eye is one of those things. You have 2 million patients every year in the US going to emergency departments with pink eye, and that costs the system $1,500 per exam. Now, that's just ridiculous, and we're going to help with automated diagnostics for that. The problem, though, is closed loop automated diagnostics are a very long path. So even before that, we're going to work on things like clinical decision support and triage, and those are going to be nice segues. Alpha, our research prototype, is meant to build up that data set that is lacking, and every time a visual exam gets performed. And so all of this is oncoming. But it is a long process. We're working on telemedicine as a bridge to AI to help both generate value for the customer and to our company in the near term.
Okay, and our final question will come from Jennifer Jordan.
Great, thanks, Scott. My quick question was about how much you think you can accelerate that path in terms of data collection and how much of an advantage going to market right now with the COVID problem gives to you. That feels like it was a lucky and serendipitous moment.
Yeah, I forget who says it. Wayne, skate to where the puck's going. I mean, we've been doing that from the beginning, and yeah, COVID helped rocket our company forward in that regard. We did get lucky in that, but it's really meaningful to be able to provide value now with this telemedicine focus. And that's a competitive advantage that a lot of these other stodgy device manufacturers who have their engineering and legal teams furloughed right now can't capitalize on. So we're really well positioned to take advantage of the situation.
Yeah. So our clinical partners right now, we're working with 4 large academic hospitals who see, before COVID, they're seeing thousands of patients per day. And that is the volume that we're looking at by working with them.
Great. Okay. We're going to now move to the judges going to process their scores. Let's have a big thank you and congratulations to Team Ocular. Really so interesting. I've been hearing about that for the last few years. Great to see how it's developed as well as the adaptation. And let's also use this time to meet another one of tonight's judges, Adam Falcon. Adam is a managing director at General Catalyst, invests broadly in consumer internet and SaaS. Prior to GC, Adam was a venture partner in the London office of Excel. Before that, he was actually in digital media at the television production company Endemol, a partner at venture capital firm Arts Alliance. Adam's worked with entrepreneurs for almost 20 years since his first job at a VC-backed startup in Boston in 1996. And he's also co-founded 2 companies with successful exits, Love Film, acquired by Amazon, and Property Funder, acquired by REA. Right now, he's on the board or actively involved with, among the General Catalyst portfolio, Bustle Media Group, ClassPass, Deliveroo, Funbox, Giphy, Monzo, Rapid, Rebag, Remesh, Row Health, Shift Technology, Super Evil Megacore, Trust, Vroom, and WayUp. Big thank you to Adam. That is a lot on the portfolio. Thank you very much for that. Okay. We are now up to our, I very rarely get to use the word penultimate. It's time for our penultimate pitch of the night. Let's welcome Spacemetrics, a team just enabling the design of healthier buildings. Sanal Singh, a co-founder and CEO and an MBA from MIT Sloan, 2019. Looking forward to hearing from Sanal. Take it away.
Hi, everyone. My name is Sonal Singh, and I'm the co-founder and CEO of Spacemetrics. I'm here today to talk about how architecture affects our health. The research has proven it over and over again. The buildings in which we all live, work, and connect with each other have a profound influence on our everyday well-being. Even before COVID-19, we spent an average of 90% of our time indoors. Nowadays, it's never been more important to ensure that our indoor environments are promoting our health and safety. When it comes to creating these environments, architects are being challenged to design, iterate, and build spaces in ways that go well beyond their architectural training. Clients are demanding research-backed best practices, ever-shrinking design turnarounds to minimize timelines, and data insights to reduce operational uncertainty. Firms have the choice of either building up expensive research teams that still don't have the bandwidth to do this comprehensive work, or they risk falling behind and losing out on project commissions. Either way, architects don't have the tools to efficiently meet today's client demands. That is, until now. At Spacemetrics, we analyze floor plans to help architects and their clients save time, save money, and save lives. We do this by using computation to extract unstructured, qualitative aspects of a layout and turn it into structured, usable information. Our first product is for healthcare architects, where the human and financial stakes of design are incredibly high. Here's how it works. An architect can upload a floor plan, and our software automatically translates it into over 200 spatial features. The architect then receives intuitive visualizations and holistic scores to guide the improvement of a hospital layout throughout the design process. Our metrics matter because we've combed through the growing body of research to codify the most crucial metrics of healthcare operations. For example, whether or not a nurse can see into a patient room has been proven to affect patient mortality, and we've captured this design aspect through our comprehensive supervision metric. Programs like LEED have already created a strong precedent for measuring and endorsing the sustainability of buildings. But our customers love that they can better analyze the human and health impact of design during the design process. We've already gotten started on helping architects to put concrete numbers behind design trade-offs and iterate layouts that create better health outcomes. To date, our projects with the Dana-Farber Cancer Institute and the Beth Israel Deaconess Medical Center have both been selected to present at upcoming national industry conferences. We've also built a strong network of partnerships with architecture firms, which is also driving our upcoming pipeline of projects, including projects from returning pilot firms. Even with this progress, designing for healthier hospitals is just the beginning. By strategically starting in healthcare, we can use machine learning to build a wealth of connections between architecture and health, becoming the new standard for measuring wellness across real estate sectors. Our flexible model of charging per square foot of analysis creates an over $2 billion annual revenue opportunity. We've already expanded our impact in the wake of COVID-19. Our team released an open source social distancing toolkit to help designers and business owners create safe spaces in a post-quarantine world. We've already kicked off projects to support back-to-work planning, and the 100K prize would help us rapidly scale our back-end infrastructure to support the increased demand of both our healthcare and COVID-19 offerings. If anything, the pandemic has accelerated the need to share our expertise as a co-founding team. After spending years designing hospitals as a licensed architect in the field, Jim grew increasingly frustrated with the lack of architectural data in the decision-making process. With an MIT degree in computer science, he created Spatia's proprietary algorithms to address this gap. My training as a software product manager in the wellness industry, years of business development experience, and contract negotiation skills from sitting across the table of companies like Apple bring a seasoned business perspective to the team. We both met through the MIT DesignX community and realized that with our perfectly complementary skills, we can bridge the data gap between design and health. But we can't do it alone. So if you're a web developer or machine learning expert who believes in the power of design to improve health, we'd love to connect after the show. My name is Sonal, and with this amazing team, I'm extremely proud to be the co-founder of Spacemetrics, a company that's creating a future in which every building makes us healthier.
Thank you so much. Oh, hold on one second. Thank you so much, Sonal. Really, really fascinating. Hold on just one more second. Okay, and we're going to get the question started this time with Adam Falcon. Thank you so much.
Thank you. Congrats, Sonal. So I have two related questions. The one is, selling software is a great business, but a lot also depends on your customers' ability to pay. And I'm just curious how much work you've done and how much insight you have into how much the average architecture firm in the US spends annually on software, and then how you think about that relative to selling directly to developers who maybe have more money, and then how your product fits with other software vendors in the architecture space. So are they integrated, or people working with multiple software products for different parts of the problem?
Yeah, thank you, Adam. That's a great start. So just to kind of take those in order, we actually created a model where we can sell through architects, where we're actually incorporating into their RFP and becoming part of the project cost of their services. So it's a great way for us to kind of prove our value and credibility and have that cost pass on to the end user, which is also why we started our pilots direct to health systems to prove the value up front and then work our way through our partnerships. So from that standpoint, it's kind of a great way to get started and to prove ourselves as a startup, and then to work our way to a licensing model where we can actually, be their software or be a software provider regardless of being tied to projects. On the technology front, so we've actually been built on the community that uses Revit, which is the most popular and largely majority software component that architects use. So because of that integration, it's actually pretty seamless, and there's a good precedent for using SaaS. But the key that we need to kind of capitalize on, and our secret sauce, is the ability to make sure that we're not kind of tripping over design, but actually complementing the design process.
Great. Next question from Sarah Hodges.
Congratulations, and I commend you for putting a call to action for talent at the end of your pitch deck. That was awesome. Can you talk to us about the current state of the hospital ecosystem? Are they engaging architects? Are they buying? How often are they really making these kinds of changes?
Yeah, absolutely. So we'll talk kind of in a pre-COVID and a post-COVID world. So pre-COVID, 70% of health systems in the US have actually raised their hand to say that they have a major renovation or a new build planned in the next 3 years. There's a number of kind of economic factors that are playing into this. The last time they kind of were incentivized from an infrastructure standpoint to redo their buildings was in the 1946 Hill-Burton Act. So these buildings are 80, 90, almost 100 years old. And then we look at kind of the evolving medical technology and the way that these buildings are not necessarily sufficing for the way that people do business in a hospital today and the way that they care for patients. So that's kind of the primary factor for the wave that we're seeing. And happy to expand on that.
Yep. Okay. Is it okay if I go to Leandro Vetcher? On to Leandro Vetcher.
Sure. So a quick follow-up to the two previous questions. It would be interesting to see how you tie the health outcomes to dollars for the hospitals. That's not an actual question, but you can comment on that. My question is, what are the other opportunities beyond hospitals that you see where you can expand this product? Retirement homes, daycare. Tell us about the potential for other places.
Yeah, so the healthcare architects that are dealing with hospitals are in the same firms dealing with schools and dealing with places to live, and they're asking, can we apply this technology to those projects as well? The good news is that the metrics that we're working on have been specific to hospitals. We're seeing now that those metrics are really applicable to workspaces currently. And really the underlying technology of this analysis that's creating a structured data set from qualitative data that just doesn't get, is basically invisible in the industry, has huge potentials in the real estate industry at large.
Great. Okay. On to Ron Chaney.
So as architects use your system, they're effectively entering the evolution of their designs into the system. It seems like it could potentially be a very valuable database to draw from. How do you imagine using that database to improve your product or otherwise monetize that information? And how will you address the privacy concerns that are related to that?
Yeah, absolutely. So we've seen from our early customers that they are really interested in benchmarking, that they're and within the healthcare industry, there's a spirit of collaboration that makes that has been able to address these privacy concerns. So while we were concerned about that initially, that we've seen that that's going to be a likely avenue. I think as designers are going through the process, they will be making decisions, they'll be making trade-offs, and they're looking for kind of immediate insights that they can get through their products. So our strategy of developing the underlying technology that can structure this data in a way that it can be linked to health outcomes, that can be linked to efficiencies, to patient satisfaction, is something that we'll be in a good position to develop insight from at scale.
Great. On to Jason Troutner. Great questions.
So on the topic of sales, as you start to scale this business, what do you see as the most exciting and efficient channels available to you to acquire new customers?
Yeah, absolutely. So like we said, we're starting with architecture firms primarily because they have kind of the perfect complementary skill set to go with our MVP. And they also kind of really cut down on the sales cycle because they're already getting in front of projects and are kind of ingrained in the RFP process. But we actually see in the long term taking that a step further and being able to design or to rapidly analyze floor plans through other interfaces and even our own. So for example, special events, a lot of people have to upload their floor plans to get approval for layouts, festivals, even real estate, like real estate analytics companies offer kind of occupier services. So being able to integrate at that scale is really, really crucial for us. And we're actually seeing that demand almost overnight with COVID-19. So the 100K prize would actually go towards building the back-end infrastructure to support those types of integrations and not necessarily the one-off projects.
Great. And our final question will come from Jennifer Jordan.
Yeah, I think you just hit on what I'm most interested in, which is that seems like this is very, very high value if you start to think about corporate real estate where people have to make decisions about how much of their workforce is now sitting in a WeWork place, how do they reconfigure their offices, how quickly can you guys move to have something that could be an offering for them, for property managers who are owning apartments and offices themselves who are taking on these new risks? And then have you made any plans about how you go to market that way to those facilities managers and building teams?
Yeah, absolutely. So we're already in conversations and we've kicked off pilots for workplace analysis. And so we're kind of trialing to make sure that we can understand which metrics and which visualizations actually empower this very specific use case of back to work planning for COVID-19. And in the long term, I think the integration level is going to be really key for us. So going to people like furniture distributors, going to occupier services, that's really going to be the integration that scales and allows people to interact with their spaces. It also builds up the repeatability of the software. Right now, we're primarily focused on new builds because there's so much that people can do with the software with kind of the minimal viable product. But afterwards, we can totally see going, expanding the feature set to be that they can, play around with layouts. They can actually interact on a daily basis with the software, things like that. Jim, feel free to add.
Shift now to have a focus on playing around with layouts. I mean, I think there's going to be a lot of dollars that flow to consultants to try to figure that out quickly, right?
Yeah, and we're seeing that it's going to come in three phases. There's the kind of immediate term need, the kind of near term of in the next month, and we've been engaged in those processes.
But I think the longer term, there's going to be monumental shifts over time, and we're setting ourselves up to be able to be in a conversation as that comes to bear. It's not something that's going to go away overnight.
Okay, and what we want to do is give a huge round of applause for Spacemetrics. Sonal, it was good seeing you again, and very, very good, really great team, very exciting. And once again, I want to give our judges a few moments to record their reflections, really, really good questions. And also, this is a chance for me to introduce our final judge for the evening, Leandro Vecher, a biotechnologist from Argentina. His passion for biotech drove him to get involved in many different aspects of the industry. He's founded new companies, including Keycon and Green Pacific Biologicals. He's led drug and business development projects, organized bio-industry trade events, and analyzed policies and the socio-impact of biotech in emerging countries. He served as the Associate Director of Business Development at Harvard's Blavatnik Biomedical Accelerator, as well as VP of Research Operations at Sana Biotechnology. Today, he consults for both life sciences and biotech companies. He earned his degree in biotechnology from Rosario National University in Argentina, Columbia University in New York, before obtaining his MBA at MIT Sloan in 2008. Thank you so much, Leandro, for your engagement, your continued role in this, and for all your work. Thank you. Okay, we are now on to our final pitch of the night, though I will remind you that after this pitch, we will then have our judges undertake a deliberation session while we get to hear from our keynote conversation. So keep on the webinar for that. But we're going to hear from our final pitch of the night, Thiozin, a team disrupting the hydrogen constraining process for oil refineries. Presenting the pitch will be AJ, a graduating student at MIT Sloan 2020. Thiozin, take it away.
Hello. Last year, the world generated 56 billion tons of CO2 into the atmosphere. And a third of those came from the oil and gas sector. With the unprecedented drop in crude oil prices, our addiction to oil and gas just got a lot harder to kick. My co-founders, Ryan Gillis and Professor William Green of MIT's Chemical Engineering Department, invented a novel process to generate low-cost, low-emission hydrogen for the oil and gas sector. Now, before I get there, let me take a step back. Right now, we extract crude oil out of Earth's crust and send it to refineries that process it into fuels and products that society relies upon. H2, hydrogen, is a crucial input into this equation. Refineries spend hundreds of millions of dollars each year procuring hydrogen gas, and they use it to upgrade crude oil into higher margin products. The more hydrogen a refinery has, the more its ability to generate revenue from these higher margin products. But the problem is, the current methods to produce hydrogen are highly pollutive, contributing to 25% of a refinery's total emissions. And this is a problem for refineries because these emissions are heavily regulated. In places like California, these emissions are capped, limiting the amount of hydrogen they can produce. This problem was echoed by a plant manager at Chevron in El Segundo who said they would love more hydrogen, but they're constrained by these pollution permits. Simply put, there's pent-up demand for clean hydrogen. And that's where we come in. We recycle hydrogen at an oil refinery. And you can see why this is so valuable. We take a waste gas, H2S, something that a refinery is spending money to get rid of, and use it as our input to generate valuable hydrogen that we give back to the refinery. Let's take a closer look at our patented process. We take hydrogen sulfide and readily available water through iodine intermediates to create sulfur dioxide and hydrogen gas that neatly reintegrates into the existing refining systems. What you'll notice here is it's not just recycling, it's recycling times 3. For every unit of hydrogen sulfide that we take as an input, we generate 3 units of hydrogen because 2 come from water. It's this 1 to 3 multiple that makes this innovation such a breakthrough. And here's a photo of our 2nd generation prototype that's generating roughly 7 balloons worth of hydrogen per day, validating the underlying chemistry. Our next step is to build a commercial prototype. We've interviewed 35 customers and are in advanced conversations with Eni, Aramco, and Schlumberger, who have expressed strong interest to pilot this technology with us. Here's how we compare to hydrogen alternatives. Fossil fuel reforming, which represents 96% of the marketplace, is low cost but incredibly carbon intense. Electrolysis is low carbon but incredibly expensive. This is Thiozin. We're the low cost, low emission hydrogen source in the marketplace. Relative to electrolysis, we're 78% less expensive. Relative to fossil fuel reforming, we're 75% less carbon intense and 25% less expensive, positioning us to be a disruptive force in the marketplace. And the market is large, representing a $37 billion global market. I want to take you to the average refinery in California to illustrate what an investment in our technology would look like for them. At this refinery, they spend $16 million a year procuring hydrogen gas. Ours would cost $12 million a year, including our license fee, reducing their cost by 25%, yielding a 15% IRR, nearly double the industry benchmark, and a 4.2-year payback. It's important to note that we don't need pent-up hydrogen demand, and we don't need a carbon price. An investment in this technology makes sense anywhere. But in California, we have both. California boasts a $1.2 billion market, and they have a cap and trade system where credits are trading for $200 per ton of CO2. We multiply that by the 60,000 tons of CO2 that we avoid each year, and that results in a $12 million surplus. When we add that surplus to this equation, it yields a 40% IRR and a 2-year payback to our customer. We've got a great team to make this dream a reality. Ryan invented this technology as a PhD student here at MIT. Professor William Green is Ryan's co-inventor and a world leader in fuel chemistry. Before coming here to MIT, Professor Green worked at Exxon, where he brought breakthroughs to market. My name's AJ. I worked in aerospace and defense before coming here to Sloan and Kennedy. We're backed by industry veterans who've taken a look at our technology and are excited about its potential in the marketplace. We hope you join us in our mission to flatten the carbon curve. Thank you.
Very, very good. Very inspiring. That was our final pitch of the night, and really, really exciting stuff. Let's move into Q&A with the first question from Jason Troutner.
Great pitch. I have a question about your process. So you mentioned that in addition to hydrogen, the process also produces sulfur dioxide. Can you comment on either the value or the cost of that sulfur dioxide to your customers?
Yeah, so I'll chime in here. Hi, it's nice to meet you all. My name is Ryan Gillis. I'm a co-founder with AJ. So the sulfur dioxide byproduct within a refinery, this is not a big deal. There's Klaus units that already are designed to take sulfur gases, and so this can neatly reintegrate into that, and we do not change the inputs or outputs at the macro level from the refinery.
Great. Okay. On to Jennifer Jordan, I think was up next.
I'm going to steal a really good question I heard from Sarah last night. Who's the first new hire to this team? Like what role would bring the most value to really get this from bench to market?
Yeah, so it'll be an industry veteran who can help us design and build the pilot. So I have a lot of experience building, these experimental systems that I've built in lab, but building something that's going to sit in the mud and the rain and it's up to the code and core standards of all these professional organizations that we're subject to, that's, I'm a few years shy of sort of having all that experience. So that will be our first key hire.
Okay, very good. Good question, good answer. Leandro Vetcher up next.
Sure. So the opportunity in California is very clear. I was wondering if you can expand a little bit on what can happen in other markets, the value of this technology in other markets. Are there premiums that the refineries can charge for products generated with this low carbon hydrogen? And another related question is, are there other applications for hydrogen that have not been discussed, or maybe doesn't have to go through a refinery?
Yeah, absolutely. There are certainly many, we're sort of in the middle of a few big historical trends that make this technology even more promising. One of those trends is the amount of sulfur content in the fuels that these facilities are dealing with is increasing, which makes a large amount of this feedstock a larger potential for hydrogen. But there's also more of a focus on decarbonization. Whether you're talking about the International Maritime Organization increasing the strictures on the fuels that they're allowing, the International Civil Aviation Organization. There's all, many international organizations are beginning to impose strictures, things that actually matter, even in locations where the local governments don't care about carbon policy. And so with the input of these new policies, like, for example, the International Maritime Organization just this year instituting policies to this effect, this means that really around the world, we have interest from people in Saudi Arabia, where certainly there are not, carbon prices or carbon policies pushing their demand.
Right.
Certainly for your second question, I guess, about other uses for hydrogen, certainly our technology fits like a puzzle piece within many of these facilities because, their waste gas is our feed stream and they need what we're making. But hydrogen is also a huge input into agriculture, where it's a huge both CO2 input and cost in making fertilizers that allow, feed the world's population. So there are certainly many implementations of this that go and combine to make both sulfuric acid from our sulfur gas output and also use the hydrogen to make the ammonia that goes into these fertilizers.
So balloons are not.
Do you want to do follow-up? Yeah. Okay. On to Leandro. I didn't want to stop you. Do you have a follow-up there?
It was a silly comment. I was wondering if he was going to say balloon market.
Oh, yeah, no.
A little levity in the evening towards the end. How about Adam Falcon?
Yeah. What is the timing of your first sort of customer deployments that will really demonstrate product market fit and the sort of efficacy of your solution? And how much capital do you need between now and then?
Yeah, so our first deployment is going to be focused on this commercial pilot, and it's going to cost us roughly $850,000 to actually build that commercial pilot. We're looking to really run this for 18 to 24 months and go to market in 2022. And at that point, we'll probably be raising around about $3 million for us. But we're really deploying a licensing model thereafter.
Okay. I just wanted to check with Jennifer Jordan. Did you separately have a follow-up question? I didn't want to stop you.
Oh, sorry, Scott. No, I'm good. I forgot to lower my hand.
Okay, very, very good. I think we're just about, we got about a little bit. With any last questions for this team? I know it's we've been rifling through. Okay, got about a minute left here, or whatever it would be. Okay.
Yeah, just any comments about the carbon the carbon credits and so forth, and how much that factors into your business model?
Yeah, sure. I think the way that we see these carbon credits is we're not reliant on them, but they certainly are an attractive boost to our business model. So I think the strongest evidence to suggest that we're not reliant on them is really the interest that we've seen from these oil companies from abroad. As Ryan mentioned, a lot of oil and gas companies are trying to transition to becoming energy companies, and clean energy clean hydrogen is a crucial input. But certainly our strategy is to go into markets that are most favorable and reward decarbonization in this industry most. And by that measure, California is certainly the leader, but in good company with 46 countries that have some sort of a carbon price.
Okay, thank you. More than hot air. Okay, thank you very much, Thiozin. Thank you, team, Jay and the whole team. Really, really cool stuff. Very exciting. That concludes the pitch portion of this evening's 2020 MIT 100K launch competition. Before turning to the deliberation stage, I wanted to personally congratulate each of this year's 100K finalists. We all know the creativity, discipline, and hard work required to make it to the stage, and all of you have shown the best of what it means to be part and scaling within the MIT entrepreneurial ecosystems. The judges, I'm going to invite you to move to your private virtual room to record scores, deliberate, and choose this year's winner. We'll see them in just a bit. See you, judges. While we would, of course, love to be a virtual fly on the wall for that discussion, we might actually have the better end of the deal with a fantastic keynote fireside chat. We're extremely lucky to be joined by one of the most impactful and inspiring entrepreneurs in the world, Anne Wojcicki. As many of you know, Anne is the CEO and co-founder of the consumer genetics and research company 23andMe. She founded 23andMe in 2006 after a decade spent in healthcare investing, focusing primarily on biotechnology. Her hope was to empower consumers with access to their own genetic information, creating a way to generate more personalized information so that commercial and academic researchers could better understand and develop new drugs and diagnostics. 23andMe has built one of the world's largest databases of individual genetic information. Its novel web-based research allows for rapid recruitment, reducing time and money needed to make new discoveries, and the company has created a proven, standardized resource for finding new genetic associations and confirming genetic loci discovered by others. Anne's leadership has led 23andMe to make significant advances in bringing personalized medicine directly to the public. A graduate of Yale, this was a passion of Anne, who always wanted to understand her own genetic information, and it always been her ambition, and she brings that vision to life in 23andMe. Anne sat down with one of our first-year MBA students, one of the managing directors of this year's 100K competition, Jennifer Shin. Let's all listen in on that conversation, and then we'll come back to announce this year's 100K winner. Take it away.
Hi, Anne. Thank you so much for running the 100K entrepreneurship competition, and hello to our audiences who are joining in. So Anne, where are you based right now?
I am in Los Altos, California, in my house.
How are you doing? How is the being remote as well as for the 23andMe team?
I think it's been shocking for so many people how productive we can be remotely.
Yeah.
I think that's it's interesting. Like, one, it's such a nice, I was just on maternity leave because I just had a baby, and I felt like it was lovely being home on maternity leave, but the challenge was that the rest of the world was like still going. And so you constantly felt like you were missing out. But now I actually feel like the whole world is kind of on this break, and frankly, everyone's reevaluating how we work and how we travel. And I'm amazed at how productive the company can be, but also how lovely it is to be home. Like, yeah, I get to see my kids. I'm like, honestly, if you had asked me to do this and I had to travel, I never would have said yes. But like being able to do talks and do it remotely, like it opens up a whole new world of opportunities. And now it's the norm. Like everyone's doing it, and everyone has been forced into realizing just how great it is.
Yeah. I feel like it's really interesting. A lot of my friends are actually working remotely, so who have worked remotely before, and they're like, oh, this is going to be great because it's kind of the new normal and things are going to change going forward.
I think you're right. Like it's the new normal, and that makes a huge difference. And I also think about like the pain of like, again, you have a lot of young entrepreneurs out there. Like it's really awful. Like you come to the Bay Area and you try to find an apartment and you realize what like $5,000 can get you. And it's like not a lot. And that's a lot of money. Like, so I feel like, there's going to be an opportunity of living more remotely, coming in more periodically, but like, it'll help with like some of the housing pressure. And, and again, when we're looking for talented people, like if I find someone who's incredibly talented and they live in Montana, like I don't feel as compelled that they have to move.
I feel like a lot of entrepreneurs are really excited for that, especially not paying that kind of rent in the future, hopefully.
Absolutely. Well, let me tell you, a lot of employers as well. Like I'm very excited about this because I feel like it opens up a whole new talent pool for me.
Yeah.
Because I'm not reliant on people having to be here. So I think it's super exciting.
Mm-hmm. Well, so to jump right into it I guess, I'd love to hear a little bit more about how you came up with the idea of 23andMe. Did you always know you wanted to start your own venture, or was this the idea that really drew you into the entrepreneurship world?
No, I joke, like I ended up on Wall Street for 10 years. And ironically, like I graduated from Yale. I had a biology degree. I wanted to be a nanny. I didn't have any, I didn't have, like, I love kids. And honestly, like my mom had made me go to a job fair, and that, like, I gave my CV to someone and I got a call. And next thing I knew, I had a job interview with this group in New York. And I actually only took the job interview because I wanted the frequent flyer miles. And then obviously, like, I ended up taking the job because I figured, like, these people hired me, like, holy, like, I know nothing about Wall Street. And it was fascinating. Like, I was learning so much. Like, it was so out of my comfort zone. And it's one thing I always advise people, like, take any kind of job or any opportunity where you're learning a lot. So I was totally out of my comfort zone. I was learning a ton about healthcare, about biotech, and I loved it. I loved it so much. And like at midnight, I couldn't get out of the office. Like I wanted to sleep. Like it was so interesting to study these companies all day long. And, come 2003, after roughly 5 years of doing this, I started to realize that there were some really odd characteristics of healthcare, in that, first and foremost, there's all this innovation and such, but like healthcare system wasn't really around my best interest. And I started to realize that the healthcare system is really a B2B economy, and there's very little consumer input. And that what makes money is, like, if you're diabetic or you're obese, you make a lot of money for the system. But if you ever change your behavior and you don't become obese, or you don't, you lose weight and you're no longer diabetic, you don't make money for the system. And my sister works in public health, and she was, she would talk about obesity and the crisis and public health issues. And I would talk about it like, the ultimate money-making opportunity. And like, we're making so much money. Like, let me just tell you. And even to this day, I sit on the Kaiser Health Medical School board. And I love showing the other doctors. I was like, no, there's like obesity trackers. Like, you can invest in an obesity fund of like groups that are going to make money here. So I started to realize that there wasn't really anything like that was going to make me healthier. And I think in some ways, some of the best companies come from your own personal desire, like something I want. Like, what I wanted was, I saw, genetic companies coming out, and I was super excited. And then I started to realize, like, it's never going to come out to benefit me. And so, and I wanted to, learn about my health in such a way that I could actually prevent disease, not effectively treat it. So 23andMe really came out of this idea that I thought the healthcare system has it all wrong. And it's about empowering the individual with their own information. It's about, giving them voice about what they really want. And in some ways, starting a system that's entirely outside of the existing healthcare system. Because the existing healthcare system is so big, I think it's really hard to change it. So 23andMe, again, some of the things that we did early on is I said, I'm not going to go through reimbursement, for instance. I'm going to be self-pay. And I want self-pay because I think I want to be entirely outside of the system. Yeah. And one of the things that was also really advantageous of us is, like, I had this whole healthcare background from investing, but my family was in the Bay Area, and Google started in my sister's garage. And so I started seeing, like, the tech world, and, social networking was just in those early days of starting. And I realized there was this incredible opportunity to marry those two worlds, marry some of the healthcare side with social networking, and crowdsource the world's largest research community. And it's one thing I think about, again, as I look back on my history, is like, I never planned to be a CEO. I never planned to start a company. I wanted to be a nanny. And in some ways, every single experience in my life added up and contributed in some way to who I am today and what I've done. And the best thing I've always done is I've always taken opportunities that have pushed me to continue learning. Yeah. And so, like, it definitely came out of all those experiences. And I'll let you keep asking.
What was a moment where you realized that this interest you had in, your personal health, that there was a demand for that, where you realized that this idea, I guess, had a spark and that people wanted to learn more?
Well, that's the amazing thing, is we launched the product, and I sold probably like 900 kits or so that first day. And then my volume dried up to like 20 to 25 kits a day.
Okay.
So I think it's actually really good for people to realize that success in some areas can come overnight, and in other areas you have to work for it. And the number one thing that I realized is that I had this love of genetics, and I lived in a relatively academic family, and you're part of an elite group. Even just by being part of this call, you're part of an elite group. And that most people have absolutely no idea why they would ever want their genetic information. And it was the number one thing that I learned early on, is that I had this vision and this dream of why everybody would want it, but nobody else did. So, after a while, again, one of the fun aspects of the company was when we were only selling 20 to 25 kits a day, you have to be super creative because you got to figure out how you're going to drive volume. And so it wasn't, there was nothing. It was 5 years of figuring out how are we going to drive volume. So there was no immediate aha. It was purely just, I had this love for it, and I was determined that I was going to make sure that you loved it just as much as I did.
Yeah. I feel like over that time, it's now there's been a great amount of evolution within 23andMe. I don't know if you've had this idea from the onset, but now it's involved in drug development, and now maybe even studying the relationship between COVID-19 as well as genetics. Were some of those pivots, I guess, more deliberate, or it's something you knew early on?
It's always been part of the same. Like for me, what I took away from healthcare is like, I actually really believe like people care about research. They want to contribute. And when I would interview people, I used to volunteer in hospitals all the time. And like people are happy to participate in research if they're given this opportunity. And if I'm amazed sometimes by again, all of the social media channels. They'll say, my colleague's child is sick, will you donate money? And you don't know the person and you raise money. I mean, it's amazing what these websites do. So it shows that there's this incredible desire to all help each other. Yeah. And so what I wanted to do was really create a platform that was not disease specific in any way, but it was just like, we're millions of people who care. And so when the time comes and I ask you to engage, like you answer questions. In other companies, social media, in some ways we're a social media company with a purpose. And, like Facebook and Instagram and all those, like they want you to engage because like they get clicks and like that's how they make money. I don't want you to engage every day. I want you to engage when I target you with questions or I have a research study. So like with COVID-19, I emailed my customers and said, listen, like there's clearly a national crisis. Have you had COVID-19? And I have, in 30 days, we got 350,000 responses. We have thousands of people who've said they've had it. And I can very quickly start to do research studies. And the same thing applies to asthma or Crohn's disease or diabetes, where like I have people who are engaged and either people answer the surveys either because they themselves have it or they know someone who has it and they want to contribute, or they just want to contribute. Like they're interested in contributing to the body of knowledge. So it was really about how do you have a scalable platform to answer any question. And drug discovery was like one of the main offshoots of that, because again, if I'm making meaningful discoveries, no one wants a discovery to stay in the world of like academic papers. Make it meaningful.
Yeah. I guess that engagement compared to like social media, like Facebook and Instagram, it's all about the now and the impact you can make for the next 90 seconds, while the engagement that you have with 23andMe is what are those implications many years down the road, and that drug discovery could help with, or the research it could help with.
Yeah, but I find that people, people understand that research takes time.
Yeah.
And, we give people back, we don't do it all the time, but like we'll tell people like, hey, if you're taking this question, how many other people answered the question in a similar way to you? But I think what we found is like for the most part, people want to contribute to research and they would like to see a cancer drug come out or a Crohn's discovery come out. And they realize that takes time, but they're happy to participate. If all they have to do is, answer surveys or consent for something, then I find people really like, they want to make a difference. Yeah. And in some ways, like most nonprofits ask for money. And I always say like the most valuable thing you actually have is the information about you, not necessarily your checkbook.
Yeah, I agree. I guess a lot of our entrepreneurs who are applying, and many of those in our audience, are actually in the biotech or interested in the biotech as well as healthcare space. Yeah. I know 23andMe has dealt with FDA regulations, and I know that is a heavily regulated and very difficult for new ventures to kind of thrive. Do you have any, I guess, advice for some of these entrepreneurs?
Yeah, I do a lot of advising to early stage startups. And I would say, the thing about 23andMe is that we had really big dreams of what we wanted to do. And we thought about regulation in those early days. But in some ways, like, we were just naive. And I didn't have expertise in-house. So you could argue, if I had the expertise in-house, would I ever have been able to accomplish what we did? Because there's something beautiful about naivete. Mm-hmm. That said, I think that the FDA has really embraced startups, and they recognize digital health and what's coming. And I think that there's a number of lawyers and regulatory firms that actually now are much better at sort of helping and understand this area. So one thing I've always said is, like, the FDA is not as scary. The FDA likes to speak in data, and they want to understand. And in some way, it's kind of, again, you're probably too young to have children yet, but like when you have children and they're running from you, you know that there's something bad going on. So in some ways, like, it's much better just to come forward.
It's a good analogy.
Yeah. And I think it's similar in that way. Like, I feel now like I have a good relationship, and I engage with them regularly, and I like to think like the job is actually on you. Mm-hmm. To make sure they understand what you're doing. And one thing I actually compared it to, and it was one of the first things that we did to explain to the company, where we would tell people, like, look, if you want to drive, you have to get a driver's license. And when you go to the DMV, you don't question, like, why do I have to go to the DMV? You don't question, why do you have to take a vision test? Like, you just do it. And you don't try to argue with the person at the DMV about, like, whether or not you need to do things. Like, you're just obedient. And in some ways, like, it's important to have almost a similar kind of mentality. Like, there's a system to go through, and you kind of just need to do it. And when you disagree, you argue with data. And people, and like I said, we've had times where we disagree about aspects of things, and they're like, they have. Like I said, it's important then to argue with them with data. And like I said, we've been able to, resolve things.
I think in technology, it's all about moving fast, and, new ventures and startups, while this space, and, it's necessary to be a little bit more cautious and have these regulations. And I think it's interesting, especially with what's been happening with a lot of the bureaucracy and red tape for COVID-19 and the testing involved. Do you have any ideas of how that will evolve going forward, or what's going to happen in the future?
I think the FDA has actually been pretty responsive and has been on it. I think some of the COVID-19 issues, like, one, I can't fully understand exactly why. And I feel like there's operations and logistics that are more of an issue. Like I said, I think that the FDA is full of really smart people who care. Like, that's one of the most important things, recognizing is, like, the people who go and take those jobs are there because, like, they really believe in their mission and what they're doing. Mm-hmm. So, and there's a lot of bad actors. Like, that's the other thing that's worth remembering. Like, you guys are all trying to do genuinely good things, but for every one of you, there's a lot of people out there trying to scam someone. And I look at, actually, with COVID-19, like, one of the main things that happened in those early days is, like, there's a lot of scam testing.
Yeah.
And so I think that the FDA regulation is incredibly important. Like, I tweeted about it. I was like, I would love to have an at-home test But like, I'm the first to say, like, I absolutely do not think this is a DTC market right now. And I think the FDA was right coming after groups that were, going after a DTC market. So I think it's, we have to have speed. But the reality is with health is that the consequences of like harming an individual or someone dying or doing something bad, like is real. And so the onus is on you to prove that your product is safe. And I think it's a very reasonable hurdle to say, like, you have to prove that it's safe and you're not doing harm. And like I said, there's all kinds of, like, you can do that. Like, that's one thing I've learned with 23andMe is like, it took a fair amount of work for us to prove out everything we're doing, but we're a better product for it. And I think it's important for people, like, it's important for people to go through that work and prove out that their product is safe. Yeah. And again, one of the most important things for people to recognize, especially in this group, is that the FDA really cares about the claims that you're making. And they have, I forgot what the name of the act is, but there's some things where they've said, like, listen, like, there's no harm here and you guys can innovate and you can go for it. So it's worth understanding what are those thresholds where you potentially could really, where they're worried about it, and what are those areas where you can just run free. Okay. Like, clearly diets are an area where they have not been worried. So like, there's a lot of work there that you can do that's not regulated. Yeah. But the minute you start touching someone or like making a claim about something, you just have to be worried about what those potential consequences are.
Yeah. So I guess rewinding a little bit to the early days of 23andMe, I know you started in 2006, which was about a year or two before the financial crisis hit. What were some of the difficulties you faced during the time, as well as, what made you keep going with your venture?
Well, the biggest challenge we had was, like I said, our volume. We launched the product, and then there was no volume. Mm. And, and I think we had to, and at the same time, I think back on it, it was like pretty rough. We had no volume and the scientific community hated us. And I didn't have a lot going for me. It's kind of impressive that we raised money. But we persevered. And I think the vision that I had was that it was really important to have data. Like, there's nothing in healthcare where you've ever had size and scale. And so I remember saying my first major milestone was like, we just have to get to 100,000 customers. And I was willing to, I was grateful to my investors. I had really great early investors who believed in it. And I said, I just have to get to 100,000 and I'm going to do all kinds of programs to discount it and give it away, or find, I needed to seed the population with stories. And what I found is we have a naturally very viral product. And so once you learned about your DNA and you told your friends, then it inspired your friends to take it. So it became a very viral product. But I had to almost just give it away early. And so we did programs, like we went to TED and I gave it away to a lot of people at TED. I did it at the World Economic Forum. We did something called the National Senior Games, where we would set up and we'd give away kits there. We did a number of programs, and what we found is that, like, I remember actually at National Senior Games, we had no idea how many people would spit. And we said we just do as many as possible. And we got 5,000 people to spit in a few days. I remember my team was so exhausted at the end of this, because like managing people spitting, and also at this time, it's like explaining what we do, because no one had heard of this. Like, it was mentally just exhausting. Yeah. But things like programs like that, I think actually really, help get the word out. And it taught us a lot about what people, like, there's nothing better than interacting with your customer. Yeah. And so like, if you were in like such a short time frame, we were able to get so much feedback from individuals. But those early days were, like I said, were hard. And I think one of the things, there's no replacement for being stubborn and sticking to it. And like, like when I worked at NIH for a while, and my old professor, he always called me, he's like, you're the intern that never went away. And I kind of have that vision. As a child, I love that toy, you know, that you hit and it pops back up, and then you hit it and it pops back up. I forgot what it's called. What is it?
The Jack in the Box?
Yeah, not the Jack in the Box. No, it's like an inflatable toy and has sand on the bottom.
Oh, yes.
You hit it, it falls back, hit it, fall back. So I should buy that for my kids. It was so fun, but I kind of look at myself sometimes like that. Like it was, again, no one, you know, no one believed in really what we were doing, but I kept coming back. Yeah. And one thing I always do, and I always encourage people to as well, is you go after your haters. Go after the people who hate you the most and try to get one or two of them. Like even now, I love looking on Twitter when someone tweets about like how much they hate something about us. Like then I call them. I'm like, hi, I saw your tweet. I think like we have a misunderstanding. I love, and I learn a lot that way.
Yeah.
But you know, like I said, in those early days, it was rough. And so we just persevered. Like there was nothing in my mind. It was like, of course, it's like, it's all going to work out. I just have to show you. And I totally respect that I don't have the data yet to prove to you what I'm doing, but I'm going to get you that data. And that was one thing. It's like, I kept following up with people. I'd be like, I told like, no harm, no foul. Like I get, you don't believe in what we're doing, but I'll be back to you in a year and I'm going to show you progress. And we did that consistently over and over again. So I remember we used to just like lurk at meetings at Harvard. We would like, we wanted to meet George Church and Eric Lander and stuff. I just like crashed some party. I was just like, hi. I'm starting a genetics company.
Did it work out?
Yeah, I mean, I remember the first time I met Lander, and I mean, it was like I said, it was helpful. You know, we stayed in touch quite a bit. David Altschuer, who's now at Vertex, I mean, they gave a lot of feedback. George Church joined our science advisory board. But you know, like again, a lot of those people who were so negative. But I would go every 18 months or so, and I go and I give a talk, and our talks were packed. I love speaking at the Broad because I'm a non-science. I mean, I don't have a PhD or MS or anything. And it was so fun to like hear them all and like get their questions, and we're doing something a different way. But I think that's like a really important thing is like persistence is so important. Yeah. Especially if you really believe. And in my mind, there's like no doubt. Like I totally believe in what 23andMe is doing.
Yeah.
Like I really believe that we will be like the largest research organization in the world and the largest drug developer in the world. Like no doubt.
Yeah, I feel like what I'm hearing is this persistence and a refusal to hear no, even from people who don't believe you. And that's an opportunity for you to see like a different perspective on what other people are thinking, I guess.
I feel like a no, it's always about understanding what the no is.
Yeah.
And a no can be a roadblock for different reasons. But like to me, if someone says no, it means it's not the right fit. It doesn't mean there's anything wrong with me or my idea. It's like, it's not the right fit, or there's like something missing. And so in my mind, I always thought of it as like a puzzle then. Like I got to figure out what will change their mind. So like, again, one of those early days is like people really believe that you needed to have a physician give you the genetic test.
Yeah.
And so I would think it like routinely we met with people who were just like, no, this needs to go through doctor. So I would sit there and think about like, okay, well, what do I need to change? And so we did all the studies to prove that people can get this on their own without a physician. And so now when I meet people who say no because of that, I can give them that data and they're like, oh, and like now that's no longer an issue. It's like no longer, like some of the things that were so controversial in those early days, like giving people the raw data was so controversial, just not even an issue anymore. So I think part of that is just like, again, proving out, like it takes a while for the world to change. But one of the most important things I learned from my mom is that laws are meant to evolve. Like there's almost nothing in life that's fixed. And, you know, even in our company, I think back on it, like when we started the company, gay marriage was illegal. Like even Obama was out saying like, no, you shouldn't get married. And like, it's utterly accepted today. I mean, again, obviously you have your you know, other communities that have issues, but like broadly it's accepted. And so the world can change, and you just have to like, almost, it's like putting together, like you guys are all academics, like putting together the argument, like, you know, when you're writing a paper, like a beautiful paper is so great because like it builds and like you get to it and you get to like the climax of your point, like what, like all those things, all those arguments you just built up. And so to do something innovative is like that, you know, you have to build the foundations about that prove out your point, and then at some point it just becomes obvious.
Yeah, I feel like that's a very good advice for our entrepreneurs. I guess as a final question, what advice do you have for many of the entrepreneurs who, you know, are watching this right now, and how they could kind of move forward within, you know, the climate that is today?
I think that so for entrepreneurs, I think the climate today is probably one of the most interesting opportunities that will ever happen in your lifetime, because everything has been thrown up in the air. Like every part of our normal society is gone. Like, and I think it's going to take a while for people to feel comfortable going back out, et cetera. So everything is going to shift: how we travel, how we communicate, and even like, especially how you get healthcare. Like, I think you have to assume it's going to be potentially years before you can go to the doctor in a normal way. And so for entrepreneurs, there's this incredible opportunity for you to shape the world and where it's going to be. Like, it could be anything. Like, think on like in 2008, there's all these companies that got their start from that, like a lot of the sharing economy and Airbnb and Uber, et cetera. Like, so this is the opportunity for you guys. And I'm a firm believer, the best companies I have seen always come when the founder has a personal desire. Like Travis talks about with Uber. He's like, I was in Paris and I couldn't get a car. And, you know, Larry Page used to tell me all the time with Google, he's like, I just really wanted the world's information on my laptop. Like, I just was lazy and I wanted it all. And for me, I was like, I just really, like, I love genetics and I really wanted to figure out what can I do to be healthier in the world of genes and environment. Like, what can I change in my environment to actually be healthier? So I think that the best entrepreneurs, like they like, there's a problem that they see that they really want to solve. And in some ways, like, almost don't be afraid of the failure. Like, just try. Like, so many great people also have had things not work out, and that's totally fine. Every single experience pays off if you learn something. There's nothing worse than like a year of your life. There's only 1 year in my life where I worked for money, where I was like, I hate this job and all I want is the money. And I'll never, like, there's nothing worse in your life than like sucking up a valuable, precious year of your life, just like with a paycheck. And you can always, there's so many amazing things to learn. So the most important thing is just keep learning. Don't be afraid of failure. And if you see something that you yourself would want, like, see whether or not you can start something to solve that problem, because other people probably have a similar issue.
Well, thank you so much, Anne, for joining the 100K Entrepreneurship.
You're welcome. So great. Nice to meet you all. Good luck to you, 100K entrepreneurs. I wish you all the best.
Great. What a thoughtful and inspiring conversation for each and every one of us. I'm seeing here, I just want to make sure with my managing directors, I think we're all ready to go for the next stage. Okay, Jennifer's giving me the yes, that means yes. So first, you know, as I was watching that, I was just reflecting on, you know, both the role that personal passion of Anne's played, but also the role of navigating many of the challenges of customer, of regulation, you know, either sometimes, you know, of people not believing her, of then getting the people to be persuaded, and then ultimately gaining traction, product market fit that's allowed her to scale 23andMe to be perhaps the most important personal genomics company in the world. Finally, before we turn to our next piece, I do want to thank once again, I see Adam has a few children joining him. Thank you for that. I want to thank each of our wonderful judges, Ron Chaney, Sarah Hodges, Jennifer Jordan, Jason Troutner, Adam Falcon, Leandro Vetcher, and all of the judges who helped in all of the 100K launch accelerate competitions this year. Thank you very much, judges. Okay, tonight we will be presenting 2 prizes. For the second place team, they will be receiving $50,000, and the Robert P. Goldberg Grand Prize winner will be receiving $100,000. But as I mentioned right at the beginning, this is a student-led initiative. It's led by student energy, discipline, and passion. And so I want to turn it back to the great managing directors and team to announce this year's winner and close this very special, virtual, but collective evening. So over to you, Akalash, Christian, and Jennifer to announce the winners.
Thank you so much, Scott. Thank you again for hosting our first ever virtual version of the MIT 100K competition. And thank you to the finalists tonight for presenting. And finally, I want to thank the launch sponsors again, our platinum sponsor, Akamai, our gold sponsors, Goodwin, Morgan Lewis, Wolf Greenfield, and our silver sponsors, Sidan and Latham Watkins, for all of their support throughout this process. And I'll pass it over to AK for the second prize winner.
Okay, so the second prize winner for this edition of MIT 100K launch is Axen.
Thank you, guys. Thank you so much.
Thank you very much.
Congratulations, guys.
Thank you so much.
Thank you so much.
Thank you.
Thank you.
Kind of loses a little bit of the thunder, but very job well done. Okay.
Let's move on to the next one. Jennifer.
Yep. Yes. Jennifer, are you able to pull up your... Great. Okay. So again, congratulations, Agzen. Our final and largest prize of the night is named for Robert P. Goldberg. Robert graduated from MIT in 1965 and received a PhD from Harvard in 1973. Robert and his wife Judy married in 1969. Robert loved MIT, and entrepreneurship was in his DNA. After founding and taking BGS Systems public, Robert returned to MIT as a visiting scholar at the Sloan School. Here he developed a course in entrepreneurship and mentored MIT students for what was then the MIT 10K competition. Robert was exceedingly generous in the community, and that generosity has been mirrored by his family. His children and Judy felt that funding the 100K competition was an appropriate and worthwhile memorial to his entrepreneurial spirit. We're proud to honor his memory with this award. So, without further ado, the Robert P. Goldberg Grand Prize winner is Ocular Technologies. Congratulations, guys.
Congrats, guys.
Oh my God.
Whoa! Woo! Thank you, judges. Thank you.
Thank you.
Oh,
everybody.
Oh my God. This is the best graduation ever. Thank you guys all so much.
Our years at MIT.
Saving those eyeballs in the future, guys.
Woo.
Oh man, this is the most incredible night. I really don't know what to say. At the end of
Awesome.
all about the patients. Thank you guys. Really appreciate it. We're going to help out a lot of people this summer.
Thank you so much.
Thank you.
Great. Yeah, we really look forward to seeing what you guys can do at AgZen and all of our finalists as well. So thank you for sharing this night with us. Again, congratulations to Ocular and to AgZen. And then a special thank you to everyone for joining us tonight and making it a night to remember. Thank you to our keynote. Thank you to our judges, our sponsors, our host, Scott, and most importantly to our competitors for their fantastic presentations. Take care all and good night.